Congressman Paul Ryan's 2012 budget proposal offers major cuts in spending. Now, some of those cuts are aimed directly at defunding the president's health care law. Joining us now is Dr. Sreedhar Potarazu, who says the law is nothing more than a shotgun approach to fixing health care and that it could end up doing more harm than good. Doctor, thank you for joining us tonight. What do you make of Congressman Paul Ryan's proposal, because he's going to completely revamp, or wants to, Medicare and parts of Obamacare?
Well, if we don't put the brakes on, according to Paul Ryan's plan, we're in big trouble. A year ago, because we forced this outrageous health care law through the door, we're now sitting here across the street waiting for government to shut down because we've written a blank check for this new law with no idea of how to pay for it. And so the first step for cutting Medicare in terms of when the dollars are allocated and to make sure that we spend that money smarter for an entitlement is absolutely mandatory, because we've just figured out that we've been writing too many blank checks and we've now bankrupted the entire country. And we've got our backs against the wall right now in terms of really having no other choice.
But, Doctor, we are sold, right, by the left that is the exact reason that we need the president's health care law, because spending is out of control, that this will help rein it in. And yet now we hear on the right that, well, if we don't repeal or defund Obamacare, we're going to go broke. I mean, how do you square that? We're hearing two very different stories.
Well, you can't square that, Brian, and that's exactly the point, because the Democrats have been saying that time and time again, that we need to put these programs in terms of cutting cost, but it's this ignorance in terms of what it's going to take to actually rein in costs that they've now issued thousands of exemptions. All of the factors that have now gone in that apparently were going to save money in terms of that $1 trillion health care bill are out the window. So not only have we spent $1 trillion on the bill, we no longer have the mechanisms to recover that money, which were supposed to be the things that helped us, recover that down payment. So the credibility is lost in terms of the overall execution. The credibility is lost because health premiums still keep going up. The credibility is lost because the states that are now having to take on more people with Medicaid don't have the money. The credibility is lost because...
Doctor, the states don't have the money, and then they have to go begging to the federal government. We know that. Part of Paul Ryan's plan is to offer block grants to the states. Do you believe that states do a better job at managing Medicare and Medicaid and health care than they can do without the federal government being involved at all, with the exception of those block grants?
We're going to have to get them to put their money where their mouth is. We can't expect the states to be able to be completely dependent upon the federal government, because the federal government has not figured out the amount of money the states really need, and that's the problem. They're asking the states to take on all of these new enrollees in Medicaid, but they're not backing it up with the right amount of money. If you look at the exchanges they've asked the states to put up and have in place, I've said this before, that the money they've put up front to actually help them, it's laughable. It's a drop in the bucket. It's not even going to get them to a starting point to put those exchanges up. So if they're serious about helping the states, well, then everything that they've done so far has really done nothing. And so the states are sitting on the sidelines saying, well, wait a minute. If we take the leap and we all of a sudden go out and put these exchanges up or expand Medicaid, and the government backs away because they've backed away on everything else, we're left holding the pot.
Well, right now, Doctor, it is law of the land. How has it changed medical care already?
It has gotten worse for consumers as far as medical care is concerned. It's harder to get into the doctors. You wait longer, and the quality of care is going down because you can't force a higher volume of patients into the same number of doctors and expect every individual to still get the same level of care. Mistakes are going to be paid, people are going to wait longer, and things are going to get missed. It's a fact of the matter. It's simple supply and demand. We don't have enough physicians in order to supply that. So when I put my doctor hat on, it's a simple equation. Things are getting worse.
Dr. Sreedhar Potarazu, good to see you again, Doctor. Thank you very much for joining us.
Thanks for having me back.